Hi everyone, I'm Semagana Joseph of Big Game Animal Breeding Farm. Thanks once again for joining us on our YouTube channel. Today I'll be discussing a very important principle that we do carry out on our farm. That's about vaccination. What's the purpose and the importance of vaccination? So the main purpose of vaccination is to boost our body's immunity against diseases, therefore increasing its overall performance in the long run. This is one of the most important activities we do carry out at the farm. We do vaccinate. For us in our country, Uganda, we do vaccinate against PPR, CCPP, goatpox, Brucellosis mitaensis, Clostridial, and of different countries do make different vaccinations according to the diseases which do attack them in their countries or regions. So, before vaccinating your animals, make sure that the vaccine is properly transported from the place where you have bought it from, because this vaccine usually are packed in ice. So if you're moving it maybe from town, like for us we buy it from Container Village to our farm in Tiana, you should make sure that it is properly packed, it is in ice, so that by the time you use it, it is not contaminated, because you may assume that you are vaccinated, yet you are vaccinating a vaccine which is already contaminated. As you can see, that is a vaccine for PPR. So it's good to know that the storage of the vaccine or the place where you have bought your vaccine is trustable. So you have to buy from recognizable people. Like for us, we use Amazon Pharmacy. So dear farmers, vaccination is one of the most important activities that's carried out at the farm. If you want to avoid problems at your farm, you must vaccinate. So vaccinating goats properly and in a timely manner will give your goats the best chance of a long, healthy life. At the same time, it gives you peace of mind to know they are as protected as they can possibly get when it comes to illness and diseases. Each time you administer a vaccine, be sure to make a record of it, so the process of animal vaccination will be as streamlined and hassle-free as possible for both you and goats in your life. Among the diseases I'm going to discuss is PPR, Pistides petitis ruminants. This is a viral disease caused by a ammobilvirus closely related to Linda pestivirus, and it affects goats and sheep. This only recourse left to control the disease is by vaccination. So treating PPR is not so easy. The easiest way you can do is to vaccinate before the disease attacks your flock. PPR is severe, fastly spreading diseases of many domestic small ruminants. It is characterized by sudden onset of depression, fever, discharge from the eyes and nose, sores in the mouth, disturbed breathing and cough, foul-smelling diarrhea and death. So when you enter in your flock and you see such a signs, know that you are attacked by PPR. We also have CCPP, Contagious pneumonia. This is a serious disease of goats and sheep, and it causes a lot of deaths if not properly managed. It is caused by mycoplasma. It's called the MCPP. The disease is characterized by severe cell fibrinous pneumonia, very high morbidity, and mortality of 80 to 100%. CCP is spread through inhalation of airborne droplets from coughing or sneezing animals and direct contact of goat to goat. The clinical signs of CCPP are severe respiratory distress associated with celomucoid nasal discharge, coughing, fever, and general malaise. Early CCPP vaccination is the essential and cost-effective manner and prevention of animal-to-animal transmission. So it is so good that you are vaccinated these diseases earlier before they attack your flock.
Another disease we do vaccinate against is Brucellosis mitensis. This is an infectious bacterial disease that can affect most domestic animals, but especially goats and sheep. The bacteria causes severe, debilitating disease in people, causing brucellosis in people globally. The symptoms of brucellosis in goats include abortions. Abortions usually occur in late pregnancy in sheep and during the 4th month of pregnancy in goats. And again, you may see signs and symptoms of retained placenta and swelling of the testicles. It can also cause mastitis and lameness in goats. So, usually, when you see your goats aborting, doesn't always mean that it is because of brucella. Even stress can cause that. But at times, when you see that your goats are aborting in the late stage when they are towards giving birth, at times you see they are giving birth or they are getting miscarriages, and again they're having intended placentas. So you should check whether you did not vaccinate against brucella. It may be the cause, because it causes miscarriages and intended placentas. Another disease that we do vaccinate against is OFF. OFF is a viral disease. The OFF virus is a member of the Parapox virus. Don't these words are so complicated. Parapox virus genus. The virus primarily causes infection in sheep and goats. Although it can be transmitted to people, OFF virus infection in animals is commonly referred to as sore mouth, scabby mouth, or contagious ecthyma. The common symptoms and signs of OFF virus infection include early in the infection, sores appear as blisters that develop into crusty scabs. Sores are typically found on the lips, muzzle, and in the mouth. Sheep and goats may get sores on their lower leg and teeth, especially when airways and doors are nursing infected lambs or kids. Vaccination is key in stopping an OFF outbreak. Another disease that we do vaccinate against is goat pox. This is a contagious viral disease of small ruminants. It is characterized by fever, generalized nodules, widespread skin eruptions, internal lesions, particularly in the lungs, and death. Sheeppox and goatpox are both caused by strains of capricpox virus, all of which can infect sheep and goats. Sheep and goat pox are contagious viral skin diseases of sheep and goats. So the disease usually attacks the skin. The blistering skin lesions that form during infection can lead to substantial economic losses due to decreased milk production, damage to hides and wool, and possible import restrictions. The 6th one is Clostridium. There is 2 different types of Clostridial strains that is primarily affects lambs and goats kids, and that's Clostridial type C and D. So the C, D, and T vaccine is for Clostridial type C, Clostridial type D, and tetanus. Ideally, it's good to vaccinate the pregnant goats and sheep a month before producing, because this booster shot will go on in the colostrum, so when the kids take colostrum, they will be protected. It is more efficient to give baby lambs and goats CDT initial dose at 6 to 8 weeks of age and a second dose 3 to 4 weeks later. Initial dose will be so effective when given in two doses. This protect the babies and keep them healthy. This usually greatly affect the little ones as compared to the older ones, because for them they will have developed higher immunity. So it's very good to give it to the pregnant ones which are about to deliver, like 3 weeks to 2 weeks, because at least there you see an increase in the size of the breasts, knowing that they are about to deliver. So that vaccine will not go direct to the kids, but it will be there in the colostrum, which means when the kids start suckling on their mothers, they will be getting that immunity already from the milk they will be getting from the mothers. Thanks so much for watching. Please make it a point to subscribe to my YouTube channel. Don't forget to leave a comment and to press the like, thumbs up for the video. May God bless you all. And dear farmers, always remember that vaccinating these animals is the most cost-effective way. So instead of being attacked by the diseases, it's far better that you vaccinate earlier before you are attacked, rather than spending more money or losing your animals. So I would advise any goat farmer or a breeder to do vaccination on time, as I was saving your animals and saving your money. Because if you don't vaccinate, assume people attacks your flock, you lose a lot of animals. That's already your money. You'll be losing a lot of money. Just see, buying a vaccine of PPR is just 70k and it serves 100 goats. So it is cost effective in the long run. Don't wait to be attacked and then you think about it. And if you are breeding, any breeder should vaccinate as a way of retaining a steady market, because otherwise, if you give it to people who have bought it from you as a breeder and they lose animals from all those 6 diseases, that will mean that you are not a true breeder. You may think that you are safe, you have not vaccinated because you are not yet attacked, but once you are attacked, that's when you realize that you have been joking with the disease. So we have to be critical while handling our animals. Thank you so much for watching.